Here we are on the couch with Kate Baddock. Kate's from Snells Beach. Kate, an interesting session there before with a wide range of panel. Who was on the panel?
There was Stephanie Peterson, who's a trainee intern at Hawke's Bay. There was Alistair Dunn, who's a GPEP 2 trainee at Auckland. There Ron Jane, who's an experienced GP from Wairoa, and John Dunn, who's a laparoscopic and hepatobiliary surgeon based in Auckland.
Talking about what can we do better for our patients?
Yes, very much so. This was about, they were given reasonable license to speak about what they wanted, as long as it was about doing better for our patients. What can we be doing that's different or better in the way that we work with our patients?
Was there a different range in thoughts from age to experience?
Oh yes, very much so. The students were very much doctor focused in their approach to the thinking, and it was very much around let's reduce antibiotic use, let's reduce polypharmacy, let's try to get doctors to engage more with IT and not be threatened by new developments.
So is that practical with an experienced hat on? Is that a practical way of dealing with things?
The unkind thing to say would be to say that it's naive and simplistic.
Yes.
But it was important to hear the message that these are people coming through who in 6 months' time are going to be doctors, and this is their perception. And if this is their perception, we need to take that seriously. And we need to either refute it or deal with it or move on from it or whatever it is that we need to do. But we need to recognise that that's what they're coming out with, and that's what we need to deal with. So it's an important message that they were giving us, even though we might not agree with its content necessarily.
So what are the barriers then? Funding? Time?
Funding's always a barrier.
Yes.
It's actually one of the other issues that the medical student raised, was that we may be spending too much time or too little time with patients, but there was an acknowledgement that in order to provide the time that patients needs a more flexible funding model, so that you're not got a prescribed time frame for your actual normal standard appointment.
So in reality, in your practice, are you able to be flexible in your timing?
In reality, it takes quite a lot for patients to understand why we run late. For instance, if a patient turns up 15 minutes late, they have an expectation that they will still be seen. So if I was running on time up until that person who should have been there, and they're not there till 15 minutes later, and no other later patient has arrived early, I am automatically going to be at least 25 minutes late for the rest of my morning or afternoon session, simply because that patient is 15 minutes late, and they don't get that. They think that somehow later on, not that person, but later on, the other people who have been waiting don't appreciate that that's the reason that I'm running late. So I think that if we can educate people better about what they bring to a consultation, and therefore have a more realistic expectation of what can be managed in a single consultation, or to make more time, or to bring several problems into several different time frames. That's what we need more of.
What about nurse triage? Is that a funded way of dealing with issues?
Nurse triage is funded by employers of practices.
Yes.
They are not really a way of managing that expectation. They are a way of managing people who walk in with acute situations, whether they be illness or injury, which may or may not need to be seen promptly. And so most practices, ours included, have a triage system set up so that those who think they need to be seen and for whom there are no standard appointments will be triaged and seen according to that triage process. But that's not true of the people who simply book an appointment with the doctor.
Great. Kate, thank you very much. We're going to be speaking to some other members of the panel soon, so thank you very much for your time. We'll be back in a moment.
Thank you.